afternoon. I'm here with Ministers Schweitzer and Coppy, and I believe we're joined in Edmonton by Doctors Hinshaw and Yu. And I'm first of all, before I get to today's COVID update, I do want to highlight some very important economic news that occurred here in Alberta yesterday with the announcement by Dow Chemicals Limited of their intention to build the world's first net zero carbon-emitting ethylene complex in Fort Saskatchewan, building on a plant they've had there for many years. But this has the potential to be a massive renewal and expansion using cutting-edge technology that once it receives final regulatory approval and final investment decision, could very well represent the single largest investment in Alberta's economy in over a decade, and likely the largest investment in Western Canada in over a decade, with the exception of the LNG Canada project. So we were delighted with this incredibly good news for Alberta jobs and for our economic future, a project that will be both great for our traditional oil and gas sector, but also for diversification. As we build Alberta's petrochemical sector with a vision of $30 billion of investment by 2030, this project will be a key part of it. That will mean a significant increase in demand for Alberta natural gas, which will mean increased upstream investments in exploration, but also for service companies across the province. And at the same time, it's about diversification using cutting-edge technology and leveraging Alberta's major investments in carbon capture and storage infrastructure to create products that are in demand for export all around the world. I want to thank Dow for working so closely with us over the past 2.5 years to come to this initial announcement. We look forward to continuing to work with them. And it's, I believe, a confirmation that Alberta is on the right track in its open for business strategy and the Alberta Economic Recovery Plan. The job creation tax cut, the enormous reduction in the red tape burden, the pre-approved regulatory zones like in and around the industrial heartland, the flexibility for municipalities that we've created to provide municipal tax incentives, the application of that to machinery and equipment, the petrochemical incentive program, Alberta's natural gas strategy, the carbon capture and storage infrastructure, which we are expanding. All of that and more is what has made allowed Alberta to beat jurisdictions around the world like Texas and Louisiana and Southeast Asia to attract this investment. And let me tell you, there are more investments of this nature that we are working on, with good news to come in the months ahead. Having said that, let me turn to provide you with an update on COVID-19 and Alberta's Restriction Exemption Program. Since launching the REP just over 2 weeks ago, we have seen 337,000 Albertans receiving a vaccine dose, either first, second, or third vaccine shot. In fact, by tonight or tomorrow, we will likely hit 85% first dose coverage within the eligible population, a major increase from the 78% that we were at just a month ago. So thank you to the 250,000 Albertans who have stepped up to protect themselves, their loved ones, and our hospitals. Every Albertan who chooses the protection of vaccines is one less person who could end up in hospital, putting even more pressure on our system and forcing even more canceled surgeries. Currently, there are 1,094 Albertans hospitalized with COVID-19. 70% of those outside of intensive care are unvaccinated. Those are folks in non-ICU beds. And of the 248 Albertans in intensive care with COVID, 87% are unvaccinated. Of the 93 admissions to hospital yesterday from COVID-19, I understand that 66 of them, were unvaccinated. So the bottom line, so what we know is that vaccines work, and that's why we introduced Alberta's Restrictions Exemption Program, or Proof of Vaccination System, on September the 15th. And today, we are announcing new supports for eligible businesses who choose to participate in the Restrictions Exemption Program. First, we're announcing that we'll soon be offering a one-time payment of $2,000 to Alberta small and medium-sized businesses who are eligible to or who choose to implement this program, to help with them with some of the fixed costs associated with it. Minister Schweitzer will have more to say on the new REP implementation grant shortly. This funding is designed to help offset the cost of implementing the Restrictions Exemption Program, but eligible businesses will be able to use this funding flexibly in the way that they see fit. There will also be an additional $1 million available for training to support the safety of workers when implementing Alberta's Restriction Exemption Program. And we'll be building on the ProServe program that has long existed to help licensed hospitality businesses. Eligible industry associations across Alberta can use the new REP training grant to develop or procure training to support workers to assess and manage challenging situations that may arise during their daily work. Workers and employees will be able to access this training through select industry associations, which Minister Schweitzer will outline in just a moment. And finally, to support businesses implementing Alberta's Restrictions Exemption Program, will provide legislation to protect businesses who require vaccinations for employees or who implement the program from legal challenges, and to protect workers on the front line from harassment and mistreatment. We will be doubling the maximum fine for mistreating public-facing workers from $2,000 to $4,000. The bottom line is this. Vaccines are essential to avoid a collapse in our healthcare system and even more preventable deaths. And we're doing everything we can to get as many Albertans vaccinated as possible. The Restrictions Exemption Program is another part of these efforts, and it is paying real dividends. That's why we're making it easier to use, helping businesses utilize the program, and protecting those Alberta businesses and workers who have implemented this program. I should also add that we'll be hopefully launching the REP machine reading app next week. That application should be available to go online. It's being tested this week to improve the security of the system here in Alberta. And finally, before I move on, I want to say once more a reminder that we're coming up to Thanksgiving weekend, when families typically get together, sometimes in large numbers. And I just want to remind folks, as I did on Tuesday, that the second wave of COVID, which put severe pressure on our hospitals last fall, started very clearly around the family table of millions of Alberta households Thanksgiving of last year. We are seeing positive signs and positive trends with case numbers, the positivity rate, the rate of transmission, and new hospitalizations coming down. That is good news, but it is still very early, and those gains are very tentative. They could all be lost overnight this weekend if Albertans do not carefully follow the public health guidelines that we have put in place to protect our healthcare system, which is still under severe stress. So I plead with Albertans not to read into some recent encouraging data a license to ignore the public health guidelines and restrictions that are in place. So once again, please, particularly over the days to come, if you are not vaccinated, that is a choice that you have made, but please understand that you are at a much higher risk of both transmission, infection, and hospitalization. So we ask that people who do not have the protection of vaccination not tempt fate and potentially put more pressure on our hospitals by socializing outside of their own household. Secondly, we ask that folks who have stepped up to the plate and did get vaccinated limit gatherings, indoor household gatherings, to 2 household groups of no more than 10 people who are eligible to receive the vaccine. That's 12 and over. And we do that because we acknowledge that the chances of infection or infecting others is much lower if you've been vaccinated, but it's not zero. And so we all need to do our part to limit transmission in the critical days ahead. And as I said on Tuesday, I hope that as all of us find our own ways to celebrate Thanksgiving, that what we will be most thankful for are Alberta's healthcare workers and the sometimes heroic efforts that they have been making to save lives under increasingly difficult circumstances. So please have a thought for those folks, and if it's in your tradition, say a prayer for them. But most importantly, act responsibly to show our gratitude collectively to the nurses, doctors, and other frontline healthcare workers who are doing so much to save lives in our province. Please show thanks by doing what you can to limit transmission, or if you've not yet been vaccinated, to join the growing number of Albertans who are. Thank you very much, and with that, I'll hand it over to Minister Schweitzer.
Thank you so much, Premier, and thank you for everybody participating here today. I also want to say a huge thank you to all of the small businesses, the chambers of commerce, the business organizations that have met with us over the last few weeks to troubleshoot challenges, to give us real-time feedback on various health orders that have been put in place over the last few weeks so that we could solve the challenges facing businesses across Alberta and hopefully have as little disruption as possible to their business operations as we get through this fourth wave of the pandemic. So huge thank you to those businesses, because the recommendations that are being brought forward here today and the policies being implemented came directly from that feedback. And as the Premier mentioned, the first step that I want to highlight is the legislation that we're going to be bringing in to provide greater protection for businesses that bring in vaccine mandates for their workforces, as well as those that implement the Restriction Exemption Program. We've heard loud and clear from businesses. Some operations, they've got sophisticated internal legal counsel. They can hire legal advisors to give them advice on this. And we've seen major companies do this. You've got airline industries, we've got the government of Alberta, you've got law firms, accounting firms. But for many small businesses out there, there's uncertainty to them, and they have many questions. And we've heard loud and clear from them that they want certainty going forward. That is why we're moving on this legislation to provide absolute certainty that they can put in place a vaccine mandate for their workers, as well as implement the REP program without worry about frivolous lawsuits coming their way. So that's number one. Number two that we heard from small businesses that are putting in place the Restriction Exemption Program is that there's costs associated with it. It's going to be QR code scanners, other steps that they have to do for training with their workforce as well. So that's why we're going to be putting in place a $2,000 per company program. It's going to take us in the neighborhood of 4 to 6 weeks to get this off the ground. Similar to other programs that we've put in place, we have to get the back end databases and portals all put into place. So this is going to be, the details of that are going to come in the coming weeks. But anticipate that it'll be live in about 4 to 6 weeks for businesses to get the $2,000 support that they need and deserve to get through this implementation of the REP program. And this one here, I just want to, again, appeal to the common sense of Albertans. And the reason why we're increasing fines from $2,000 to $4,000 for people that are abusive of frontline workers is that we've heard instances of individuals that are not in favor of vaccinations, that aren't in favor of providing that ID, going in and harassing workers on the front line in some small businesses across Alberta. That's completely unacceptable. And we want to send a strong signal that that type of behavior will not be tolerated in Alberta. We can accept it. It's not a part of our culture. We condemn it. So that's one of the reasons why that we're increasing that fine from $2,000 to $4,000. As the Premier mentioned as well, we want to make sure that we provide those workers with as much training as possible to deal with a de-escalation of a situation, making sure that they can keep themselves safe and also make sure that the environment is safe for those around them that are customers of those businesses. So we're going to be providing $1 million of training for business organizations to help that, similar to liquor serving protocols that we have in place to make sure we have safe work environments. One other thing I just want to highlight, and again, this goes back to that real-time feedback. If you're a small business out there right now, and you think that we could improve the system, if you think that we could make it better, make sure you reach out to us. We're trying to solve these challenges in real time. One example I'm just going to provide here today, or two examples. One was food courts. Food courts reached out to us right away after we brought in place the REP program, and we solved that challenge within a matter of 24 or 48 hours. Similar challenges brought forward to us around quick service or fast food restaurants, around whether or not they should be checking identification for people that have been vaccinated at the door, or whether or not they could do that at the till. So we've made that change as well to make sure that they could do that at the till. That helps them with their safety for their employees, but also makes it more efficient. Perfect example is a restaurant like a Subway. Typically, there are two people behind the counter, and they don't necessarily have somebody at the front. So we've solved that and put in place that practical solution. So if you're a business and you have some practical suggestions for us as well, we're more than willing through our ministry to help work with the health team to solve those challenges, to be as practical as we can to get through this pandemic. And just to echo the Premier's comments, for all of us during this Thanksgiving weekend, let's get through this fourth wave. There's so many small businesses and just Albertans' jobs are on the line. We have to get through this fourth wave. Please listen to the health orders. Please make sure you keep your Thanksgiving gathering small, like we've asked for those that are vaccinated. If you're unvaccinated, celebrate it with your immediate family in your own home. That's what we're asking of right now of Albertans, to do this. Let's get through this. The numbers are heading in the right direction. The last thing that we can afford is to have the numbers head in the wrong direction right now. The pressure on the system is still there. We have to get through this together. And lastly, just a huge thank you to all the healthcare workers for what you've done over the last few months in particular. We believe in you, we thank you, and let's get through this together here as we move through this fourth wave. So thank you so much, and I believe we're turning it over to Dr. Hinshaw next, so thank you.
Thank you, Minister, and good afternoon, everyone. Over the last 24 hours, we have identified 1,254 new cases of COVID-19 and completed about 15,600 tests. Our positivity rate was about 8.1%. It is encouraging to see 4 days of positivity under 10%, but it is much too early to declare victory. This weekend poses a significant risk, as you have already heard. In order to keep numbers going down, we need all Albertans to have a safe Thanksgiving by having gatherings as small as possible. There are currently active alerts or outbreaks in 751 schools. Of these, only 52 schools are on outbreak. Our healthcare system remains under extreme pressure. Consider that a year ago, we had 92 people total hospitalized with COVID-19. Today, we have almost 1,100. This time a year ago, there were 24 patients admitted to the ICU. Now there are 248. Sadly, over the last 24 hours, 13 new deaths were reported to Alberta Health. These individuals were between the ages of 55 and 91. I extend my condolences to the family and friends of these Albertans. Navigating the grief of losing a loved one is never easy, but it is even harder around the holidays. Sadly, for many families, this will be the first Thanksgiving without that person they loved. My thoughts are with every Albertan who is struggling with loss this weekend. You are not alone. Please reach out if you need support or help. The vast majority of deaths we report each day are in people who were not fully vaccinated. I want to reiterate the importance of the protection of both doses of vaccine. In addition, I want to remind you that if you are 75 or older, or a First Nation, Inuit, or Métis individual 65 or older, please book your booster dose as soon as 6 months have passed since your second shot. I know there are questions about booster doses for healthcare workers. We continue to monitor all emerging evidence and follow recommendations from the Alberta Advisory Committee on Immunization and look forward to receiving National Advisory Committee on Immunization recommendations. At this time, the evidence is that 2 doses of vaccine provides good protection against severe outcomes for all those younger than 75 years old. Our provincial committee has recommended boosters for only this older group at this time. No decisions have been made on expanding boosters to healthcare workers right now, but we continue looking closely at all the emerging evidence, and we will revisit the conversation with our advisory committee later this month. I want to take a moment now to address 2 common misconceptions I have seen about COVID-19 treatments and vaccines. The first is about the drug ivermectin. Despite what you may hear on social media, the evidence from extensive, high-quality scientific research around the world has not shown that ivermectin works for COVID-19. This drug is approved for human use to treat conditions such as infections caused by parasitic worms. But COVID-19 is not a parasite, and taking these sorts of medications on your own is incredibly dangerous. We have seen people needing hospital care for serious adverse effects after taking ivermectin. Others have gotten sick from COVID-19 because they chose a drug that will not help protect them instead of the protection that vaccines can offer. The best and safest way to protect our health is by getting vaccinated. This is based on evidence from science around the world. The second misconception I want to address is around the vaccine safety for those who are pregnant. We have seen a continued rise in the number of pregnant Albertans admitted to ICU over the last month. In fact, since my update on September 9th, when I discussed the increased risk of serious outcomes from COVID-19 for those who are pregnant, 8 additional pregnant women have been admitted to intensive care due to the virus. Between July 15th and September 28th, a total of 14 pregnant women were admitted to ICU due to COVID-19. While this may not seem like a big number to some, it is double the number of pregnant ICU admissions we saw in the entire first year of the pandemic. We need everyone who is pregnant, trying to become pregnant, or who has recently delivered to receive the protection of both doses of COVID-19 vaccine as soon as possible. This is the best way to protect you and your baby from COVID-19 and the complications that can come with it. Unfortunately, there is a lot of misinformation out there, but the data shows that vaccines are safe and effective. For accurate and reliable information, speak to your healthcare provider or call 811. Finally, I want to end today by repeating my call from Tuesday. Our choices matter, and it is critically important that we all make the safest choices this weekend. Please follow the rules in place. Go above and beyond them whenever you can. Let's make our long weekend as small and socially distanced as possible. We can connect virtually where possible and outdoors if meeting in person. As disappointing and frustrating as this may be, it is the reality of our current situation, a reality we all must face and combat together. Viral spread is still high, and our hospitals and healthcare workers are still under extreme pressure. Each of us has the power to make a difference and protect our communities. Thank you, and we'll now take questions.
Thank you, Dr. Hinshaw. We'll now move to our media Q&A. Just a reminder to any journalists here in person to please queue up at the microphone in a socially distanced way. And with that, we will move to the phones first. Operator, can you please put through our first caller?
First is Jesse Weisner with Global TV. Go ahead, Jesse.
Hi, this question is for the Premier. Are the measures being implemented in schools, like releasing the outbreak lists, too little, too late, especially considering 52 schools are now in outbreak status?
Thank you. Well, that's out of about 2,400 schools. We are monitoring that situation very closely. Fortunately, we are seeing now a decline in new cases amongst school-age children who are unvaccinated. Of course, in the junior and high schools, junior high and high schools, we have seen a much, much better situation than last year, given that about 78% of school-age teenagers have the protection of vaccine, and we believe the vast majority of their staff. So the concern would primarily be amongst children under the age of 12. And as I say, we've just announced a robust series of additional measures to help better to track infections and outbreaks in those schools, but also a huge commitment to Canada's largest program for rapid antigen testing. We are seeking a supply of 6 million rapid antigen test units to roll out to our schools and through them to parents, so that parents of unvaccinated younger school children can administer a antigen test about twice a week, and report any positive results to the government, to the AHS, and that will help us further to protect children from any potential future infection.
And Jesse, did you have a follow-up?
Yes, I do. New modeling out of BC suggests we may have hit the peak of the fourth wave, but cautioned we can't let up yet. As you mentioned, Premier, the group added Alberta can't prematurely lift measures if we want this downward trend to continue. From provincial projections, are we at or past the peak of the fourth wave? And can you release the latest provincial modeling data that's guiding the pandemic-related decisions?
Well, we don't know if we're past the peak. What we do know is that the numbers are moving in the right direction and have been for a couple of weeks. The province-wide rate of transmission fell below a rate of 1 this past week, and that's very encouraging, which means that province-wide, we no longer see overall growth. We've also seen the rate of transmission come down in all regions and all age groups. As Dr. Hinshaw mentioned, we're now 3 or 4 days into a rate of transmission in the 8 to 8.5% range, which is a lot better than the 14 to 16% it was at not long ago. And we also see of course, a shrinking total number of active cases. I think we peaked at nearly 22,000 and we're down just over 18,000 now. We've also seen a slight reduction in the number of COVID ICU patients over the past 10 days or so. Those are encouraging data points, but it is too soon to say that we have beat this thing because, as Dr. Hinshaw just said, the numbers are still very high. And we are going into Thanksgiving. We're going into cold weather season. We are going into seasonal headwinds. And over the months to come, we can expect to experience the waning effect of both immunity acquired through prior infection and vaccines. Vaccines are hugely effective, but we do know that over time they can have a tapering protective effect. So you take weather, more indoor social gatherings, seasonality, and potential waning of immunity, and we have to be very, very careful as we move forward into the fall and the winter months. I'm always happy to see good developments. And I think that credit goes to Albertans who have stepped up and got the jab, 250,000 getting their first dose in the last month, and to the Albertans who have been following public health measures. I want to thank them and recognize their sacrifices, but we are by no means out of the woods on this.
Okay, thank you, Premier. Operator, can you please put through our next caller?
Next is Lauren Boothby with the Edmonton Journal. Go ahead, Lauren.
Hi, this question is for the Premier. So many Alberta doctors have been calling for you to bring in a firebreaker or a short-term lockdown to protect our health system from collapse. So why aren't you bringing that in today, and what will happen? What will have to happen in order for you to do so?
Well, as I just enumerated, we see the trends are moving in the right direction, and we can see a clear connection between the robust measures that we introduced 2 and 3 weeks ago with the reduction in transmission in active cases across the province. So we think that the measures we've taken have been effective thanks to Albertans responding positively. We will continue to monitor the situation very closely. If this turns around in the wrong direction, if there is widespread transmission over the Thanksgiving weekend and that trips us back into positive growth, we will certainly consider additional measures if they are necessary to prevent a worst-case scenario in the healthcare system. I would just add that we should not discount the significance of the measures that are already in place. We know that the single greatest source of transmission is indoor socializing, typically at home, and particularly amongst the unvaccinated. Well, we are prohibiting indoor socializing amongst unvaccinated people. But the challenge is not coming up with the most stringent rules on paper. The challenge is broad compliance. And I think it's obvious that those who have not yet been vaccinated are largely those who are least likely to comply with public health measures. So when you talk about a, quotes, lockdown, it would effectively mean punishing the 85% of adult Albertans who've done the right thing and got vaccinated who are at relatively low risk of infection or transmission and even lower risk of severe outcomes. And yet we would likely not see any change of compliance amongst those who are unvaccinated. So this is the real world challenge with which we are dealing. But I think that with these recent numbers, we can take some encouragement that it's going in a better direction.
And Lauren, do you have a follow-up?
Yes. So in earlier this year in May, the government sent students home when there were 835 schools that had outbreaks or alerts. Today, I believe Dr. Hinshaw said, I think it was 761 schools. So what has to happen before students are sent home again? Is that something we should expect coming up soon if cases keep going up?
No, I don't think it's something that we should expect. I'll remind you, Lauren, that the spring suspension of in-classroom learning was not because of in-classroom transmission, which was still relatively low. And it certainly wasn't because of severe outcomes for younger school children who are at a radically lower risk of such outcomes than adults. But rather it was because the operation of too many schools was impaired by teachers and staff having to self-isolate and being unable to work. So the transmission rates amongst the adults who work in the system was such that many schools couldn't function, and school boards came to us and said, we have to go online for at least a period of time. What's different now? Vaccination. I think it's fair to assume that over 90% of teachers and school staff are vaccinated, and so we have much lower levels of teachers and staff on sick leave, in self-isolation or in quarantine. I don't know, Doctor, if you'd like to add anything to that.
I think just to emphasize the importance of in-school learning for children, not just for education, but for their social and developmental health and well-being. And so as such, education and the ability to participate in school is a #1 priority to preserve. And of course, the measures that were introduced 2.5 weeks ago with respect to enhanced protections in schools, we're seeing the impact of that in reduced transmission in all age groups, including the 5 to 11 age group. And then this week we introduced further measures. So again, with respect to considering moving to online, if that were necessary to do, if we saw significant transmission happening, of course, then we would make sure that that was an option to be considered. But as I mentioned earlier, it's critical to think about the whole health of our children, not just COVID, and to make sure that we are preserving their ability to learn in person through those additional safety measures that have been put in place over the last month and a half.
Okay, operator, can you please put through our next call?
Next is Kelly Kreiderman with the Globe and Mail. Go ahead, Kelly.
Hi there. This question is for the Premier. I'm wondering if there are plans to enforce the rules on social gatherings over Thanksgiving weekend.
Well, the designated enforcement agencies, police and agencies, AHS, health inspectors, have those powers. And as you know, we don't micromanage operational decisions of law enforcement agencies. These are the rules. There are sanctions, penalties available to the enforcement agencies for non-compliance. Now, having said that, Kelly, obviously, we are not going to have a police officer in every street corner checking people's papers to see if they're going to their own home or visiting someone else. So that kind of Australian level of compliance where they brought out the military literally to enforce rigid stay-at-home orders, to chase people through parks for going outside without a mask. That's the choice that Australia has made. I don't think that is a viable kind of enforcement regime here in Alberta. We ask people to respect these rules. Enforcement agencies are there to ensure that there is compliance, but in this complex and free society, we're not. We don't have the capacity or the intention of tracking what every single one of the 4.5 million Albertans does.
And Kelly, do you have a follow-up today?
Yes, I do. Thank you. Premier, on a different topic, is it intentional that you're taking a low-key role in the equalization referendum yes campaign? And is it appropriate or even desirable that this is still going ahead, given the crisis that we're seeing in the hospitals right now?
Well, Kelly, obviously I'm focused on the task at hand with the fourth wave. That is the overwhelming focus of my time and attention, as it should be, and as it is for the whole government. But other things continue to move forward in our society, including our democracy. We committed to this referendum at this time in the last election, nearly 2.5 years ago. We're keeping that commitment. And Kelly, we've had elections in, I think, 4 or 5 provinces throughout COVID-19. We just had a federal election where every issue under the sun was debated and people went to the polls. We have a municipal election on the 18th of October where people will be voting for school boards and municipal councils. So I think it's possible for Albertans to address important public issues that affect our long-term future as a province, including the need for us to have a fair deal. I don't think that's a distraction for the public. You know, people have to, society goes on, the economy has to function, and our democracy has to continue to work. Just as we have had the legislature sit more, I think, than in any other province in Canada, while keeping our eye on the ball with COVID, continuing to keep our broader commitments.
Okay, operator, can you please put through our next caller?
Next is Bill Fortier with CTV News. Go ahead, Bill.
Hi, this is for the Premier. Premier Kenney, we spoke to a family of a child today who came home from school with COVID and passed it on to an elderly family member. Their school is now listed on outbreak status, but at the time, they had no idea there was COVID in the school. So now they're wondering, and so are others, if it was a mistake to start the school year without the outbreak reporting and case tracing that is now in place and going to be in place mid-next month. What's your response to that?
Well, we're sorry to hear about any child who's been infected or adult for that matter, and of course anybody who gets sick. The reality is that the virus is circulating in the province. We have taken measures to ensure safe operation of schools, including the province-wide mask mandate for children in grades 4 and above, and a number of other safety protocols in the schools. We have just added more of those protections based on collaboration between the Department of Health and the Department of Education. But the reality is that as long as schools remain open, there is a chance of transmission. But even if we were to suspend the schools and go strictly to online learning, children will still socialize and there would still be a transmission within that age group. So this is the reality with which we're dealing, but these additional measures should provide a greater sense of protection, including the large-scale rapid antigen testing program.
And Bill, do you have a follow-up today?
Yes, I'm just going to reiterate, because the question wasn't about whether you should shut down schools or not. The question is, you know, at the beginning of the school year, there was no public reporting and contact tracing in schools. You know, was that a mistake? Because kids are getting COVID and taking it home to their elderly grandparents and others without even knowing there was COVID in the school. So was it a mistake to start the school year without those things?
Well, again, there has been information shared between schools and with their staff and with the Department of Health. There has been information sharing. We've responded to this question about contact tracing by reinstituting the system in the schools and going much further than that with the 6 million rapid antigen tests that we are seeking to as an additional protective measure for parents to help with them in identifying whether their kids are positive.
Okay, operator, can you please put through our next call?
Next is Andrea Williams with CBC French. Go ahead, please.
Hi, the question is for the Premier, and I will ask my questions in English, but if you could also answer in French, it would be appreciated. So my first question is that at least 10 UCP constituency associations are asking for confidence vote before March 1st. They are also asking for an independent firm to manage the electronic vote to ensure the security of the voting system. The RCMP is still investigating the security of the 2017 vote for the leadership of the party, which you won. Aren't you worried for the credibility of your confidence vote if the provincial party board doesn't agree to those two requests?
Well, the United Conservative Party board is responsible for all of these matters, and I would direct your inquiries to them. This is an elected board that's accountable to party members that conducts and oversees internal votes, and elections, and democratic procedure within the party. Tout le processus démocratique à l'intérieur du Parti conservateur uni sont réglés par le comité élu des directeurs, et ils le font dans une façon responsable. Ils utilisent dans tous les votes, par exemple, pour les officiers du parti, ils utilisent les organismes professionnels comme les bureaux de vérification. Et alors, je suggère que vous posez les questions à cet égard au président du parti.
And Adrian, do you have a follow-up today?
Yes, I have another question about the tracing app that the province created. So only 158 people reported having been infected with COVID through the app. This app cost millions of dollars. So how do you explain this failure?
Well, look, throughout COVID, we have, as every government has done, tried new and different approaches to limit transmission, to protect our healthcare system. That included being the first province in Canada to stand up a online tracing app. It was one of many additional tools. We had no certainty about how effective it would be. It does appear around the world that those online tracing apps have been less effective than was originally hoped, but I don't think we should criticize efforts, creative efforts to apply technology to these issues. I mean, you don't make any progress unless you are willing to take some risks, as we did in that instance. I think it was a justifiable expense. And I think proportionately, you haven't seen a significantly larger number of cases identified through the federal app, which actually wasn't a contact tracing app. One of the advantages of the Alberta Trace Together app is that it did link back in to the Alberta contact tracing system. So, throughout this, when it's all said and done, there will be a wide-ranging retrospective study to learn lessons about how we could have responded better to COVID-19. I'm sure we'll find a number of areas where, for example, in procurement, we went very big on huge orders early on in order to ensure that we didn't run out of personal protective equipment like some other jurisdictions did. It's quite possible that we ended up over-ordering some things and that there was some spoilage. But those are the kinds of risks that you take when you're dealing with a historically unprecedented situation like this. In French, I'll try to do that more briefly, partly because there's a lot of technical words in there. But pour dire que, écoutez, nous avons essayé les nouvelles choses pour s'adresser à un nouveau défi. Et nous étions la première province au Canada d'adopter un système informatique pour tracing. Et je crois que globalement, ces systèmes-là n'étaient pas si efficaces que nous avons, qu'on en voulait au début. Mais je crois que ça vaut la peine d'essayer les nouvelles approches. J'en suis certain qu'à la fin de COVID-19, nous aurons l'occasion d'étudier la réponse du gouvernement et voir où il y a les problèmes. J'en suis certain que nous avons acheté l'équipement médical au début supplémentaire que nous n'avions pas besoin, enfin. Alors, j'en suis certain qu'il y a un certain gaspillage, mais nous faisions face à une situation sans précédent.
Okay, thank you, Premier. We'll now turn over to some in-person questions. I see Janet French camped out at the mic here from CBC in Edmonton. Go ahead, Janet.
Hi there. This is for Minister Copping, if he's still there in Calgary. While you're getting sanitized, I'll just start. So back to the AB Trace Together app. We know that it didn't work properly from the start. And today I talked to some people who said they couldn't even enter their positive test results into the app. That some people said they were never told by contact tracers to upload data or enter that positive test result. And some people got these codes to try and enter their positive test results, and it didn't work. It just wasn't functioning. So, I mean, now that contact tracing has been demonstrably scaled back, are you still actually using this thing? And if not, why are we still paying contractors to maintain it and update it?
Well, thanks for the question. As mentioned by the Premier, we are going to be doing an assessment of all of the actions that we've taken as a government, including the functionality of the app. We are maintaining at this point in time simply because we haven't made the decision whether we're going to continue it, fix it, or discontinue it. So at this point in time, we're funding it so that we can make that decision after we do an assessment. And part of my role will be, after we get through the fourth wave, is focusing on how do we respond more nimbly to what's coming at us, whether it be a fifth wave, whether it be, are we going to move into an endemic phase, or do we have to face potentially another wave that may be more resistant to vaccines? And as part of that analysis, we're going to take a look at the app, what worked and what didn't, and whether or not we need to continue with it.
And Janet, your follow-up?
Yeah, also for Minister Copping, a different thought. I'm very curious about what you're going to do once the vaccine is approved for use in children aged 5 to 11 in Alberta. How ready are you once that approval comes along to get these shots into arms of kids, and how will you do it?
So officials are working on a rollout plan as we speak. We're watching very closely in terms of the approvals and when that's going to come. Potentially, it's over the next number of weeks to a couple of months on that. And there's some options that we're exploring is doing it at schools, but we're also looking at other approaches that we can actually roll that out. It's under discussion right now, and I'll look forward to, once we get closer to the vaccine being approved, is how we be able to explain more how we're going to roll that out.
Okay, that wraps up our questions here in Edmonton. So we'll pop over to Calgary for our last in-person question at the mic. And if I could just get you in Calgary to please state the name and the outlet that you're with, as well as who you're directing your question to. Thank you.
Harry with the Calgary Herald. My question could be for either the Premier or Dr. Hinshaw here. It's about Thanksgiving restrictions. Under current public health rules, fully vaccinated family members from 3 households can't gather for an indoor Thanksgiving dinner at one of their homes, but they could gather at a restaurant, or they could go to a Flames game with 19,000 other people. These measures seem to be incoherent with one another, and they give the message that gatherings of fully vaccinated people are only safe if these gatherings cost money. Can you please explain some of the reasoning behind these rules?
The rules take into account the fact that in structured settings where there is a responsible person overseeing a restriction exemption program that involves proof of vaccination checking, where there are enforcement potentials with respect to businesses that face potential penalties if they're not complying with the restriction exemption program. The structure in those settings enables a greater level of oversight with respect to ensuring that those measures are in place and they're robust. And it's very difficult to enforce, again, in a home setting. And so this is not about telling Albertans that gathering in a restaurant is safer than gathering in a home if all of those measures are followed. It's about saying that the ability to enforce and monitor and have structured oversight is greater in those settings. It is important to remember that outdoor gatherings can take place with larger numbers of people, up to 20 people. And the measures are in place for a short period of time right now because our hospitals are overwhelmed. So these are extraordinary measures, and they're required because of the extraordinary pressures on our system. So while I know it's disappointing, obviously last year many families chose to not have Thanksgiving because they were choosing to protect their communities. It's disappointing to be in a situation where we're facing that same reality again. But the difference is all about the oversight, the administration, and the enforcement potential in settings that are implementing REP versus in private homes.
Thank you, Dr. Hinshaw. Did you have a follow-up, Jason?
Sure. I think that this is a question for the Premier. I'm wondering how the new rules will be enforced around abuse of frontline workers. $4,000 instead of $2,000 is a bit of a deterrent, but we haven't seen a lot of enforcement of these rules throughout the pandemic.
Yeah, just to answer on this question here, and earlier on in the pandemic, I had the privilege of being Justice Minister, so I have a little bit of context as well for how the approach has been taken. Quite often, law enforcement or the health officials that are there to enforce health rules, they'll initially, when they reach out, they'll be there to inform people of practices, try and get compliance up, and then if an individual continues to disregard the rules, then they kind of up the scale of enforcement tools that are there towards fines and potentially even shutting down a business. The signal that we're trying to set here today in increasing the fine from $2,000 to $4,000 is to deter individuals that are there that have been abusive. And again, this is a situation likely where law enforcement would be called in to that situation if there's an altercation of that kind. We've had a few reports of physical altercations as well. So this would be meant to address those situations and send a clear signal that this type of behavior will not be tolerated in Alberta. We don't want this type of behavior in our province. It shouldn't be accepted. And we want to send that signal that the government of Alberta wants to make sure that these penalties are significant.
Okay, thank you, Minister Schweitzer. And that exhausts our in-person questions today, and that wraps up our media availability. Thanks so much.